Hello, good morning, everyone. Good morning. Greeting from Body Counseling. I'm Chia Wei, the moderator for today's sessions. So before we start today, we say the live sharing about the understanding addictions, drug and substance abuse. There's something that I wish to discuss with you guys first. So the first thing is, let me brief about the zones rules. So the first thing is, when the speaker is sharing, we welcome you guys to mute yourself first. So this is to ensure the going smoothly for the sharing. And then for the second, we will allocate some time at the end for the Q&A sessions. At the Q&A sessions, we welcome all of the participants to raise up any questions to the speaker that you would like to know more about. You can either unmute yourself, discuss with the speaker, or you can type it down at the comment sections. And then this, for Zoom participants, this Zoom webinar will be also going live at the same time at the Facebook. So for those viewers at the Facebook, we welcome you guys to write down any questions at the comment section there. We will collect and then we will direct to the speaker during the Q&A. And then at the last, which is we will have an e-certificate for all of the participants for today. So at the end, we will put out the e-certificate link. So for those who need the e-certificate, kindly scan and then fill in the feedback form. After that, we will email the e-certificate within 14 days of the working days. All right, so without wasting any time, let me introduce today, we will have Miss Cindy with us to share about the understanding addiction, drug and substance abuse. So before that, let me introduce you guys with Miss Cindy first. So Miss Cindy is the founding president of an NGO called the Organization for Addiction, Prevention, Treatment and Rehabilitation, OPTA. So OPTA currently is located at Kuching here, Kuching, Sarawak. And then Miss Cindy is also a registered and licensed counselor and as well international certified addiction professional. So she is a drug demand reduction global master trainer with the Colombo Plan and UNODC. Previously, Miss Cindy has worked with Ministry of Education of Malaysia, Swinburne University of Technology Sarawak campus, Monash University, and then she was also a project manager of Asian Pacific with the Colombo Plan Drug Advisory Program in Colombo, Sri Lanka. So we believe that with the expertise of Miss Cindy today, we will get a lot of useful information regarding to this topic. So without wasting any time, shall we welcome our speaker today to introduce ourselves? Hi, Miss Cindy.
Hi everyone.
Hi, Miss Cindy.
Yeah, very good morning, and thank you very much for having me with you, Body Counseling, and thank you for everyone for taking the time to be with us in this knowledge sharing session this morning.
Yes.
So let me begin by sharing my slide.
All right, sorry.
Yep. So what we are going to share this morning will be on understanding addiction and 3 subtopics under that: drug and drug use, treatment of drug addiction, and recovery from drug addiction. Now, sometimes people also use the term substance and substance use, substance addiction. They mean the same thing because drug itself is a chemical. So before we move on to look at treatment, let us look at the classes of drugs. Many people in Malaysia take different kinds of drugs, and it is good it is good for us to know where these classes of drug, where this drug belong to, which class of drug, so that we can understand better why this person is taking that and he is behaving like this. because different classes of drug act differently on our brain, and therefore it also influences our behavior in different manner from another type of drug. So there are 4 classes of drug, where it, like what you can see on the slide, stimulant, uh, for example, cocaine, amphetamine, methamphetamine, which is one of the most popular or commonly used drug in Malaysia, methamphetamine, or amphetamine type stimulant. Nicotine, don't be surprised, and caffeine. So all these fall under stimulant. What do stimulant do to our brain? From the word stimulant, they are stimulating. So they increase the activity of our brain, thereby increasing our heart rate and our breathing. And it causes an excited kind of euphoria. So someone who is on stimulant would feel really good, very happy, very excited because of the effect of the stimulant. The other class is depressant. From the word depressant, it depresses the brain, thereby decreasing the brain activity, slowing our breathing and our heart rate. So, an overdose of any of these depressant could lead to death. So, some of these, alcohol is a depressant. It actually depresses our brain. Benzodiazepine, different kind of benzodiazepine, barbiturate. And the next class is opioid. Opioid is a class of drug that selectively target that part of the brain that makes you feel no pain. So they are pain relievers. So you find that even for medication in hospital, when someone is in great pain, they are given morphine. In the old days, people used to take opium. In Afghanistan, people take opium too to relieve pain. And the last class is hallucinogen. These make you hallucinate. They distort our sensory perception. Our senses become distorted. Like when an object is very near, the person see it is still very far away. Yeah. And it also distort the perception of the person using the drug. So some of these are LSD, ecstasy, mushroom. And the primary characteristic of all these drugs, they alter our moods, whether they are stimulant, depressant, opioids, or hallucinogen. They alter our moods, our thoughts, our perception, and also our behavior. So some drugs actually do not fit into a category. For example, cannabinoids, which is example marijuana or cannabis. Cannabis and marijuana are the same thing, but some people say cannabis, some people say marijuana and hashish. And then the other type, the other class or type is dissociative anesthetic, like ketamine, PCP. Yeah, and of course, finally, we have inhalants, which consists of glue, solvent, gas, all these are inhalants. And let us look at drug and drug use. You may be asking, why is there an image of the brain on the slide? The reason is that because drug use and drug abuse affects the brain. And addiction is a brain disease, when we will look at it in a very short while. Now, there is a difference between drug use and drug abuse. So some people use drugs occasionally and may not experience any problems. We call this drug use. For example, some people may take once a month only methamphetamine or cocaine once a month, or whenever they meet their friends, very occasionally. So that is drug use. When people use drug like this, occasionally, once a month, or not very often, they may not see any problem, and there may not be any problem at all because they can still function fully. However, when people use drugs regularly, like every week they must use it once, twice, 3 times a week, that is called regular use. And with regular use, you can actually depend on drug, meaning you are already drug dependent. When you depend on drug to keep yourself alive, so you can feel the effect of the drug, the euphoria, the need to live. You only live because of drugs. That is already a drug use disorder or an addiction. So that is why you see the image of the brain in this slide. We will have a look at why in a little bit detail, why drug and drug use is so related with brain. So substance use disorder or drug use disorder is a disease of the brain. And if someone asks, how do you describe addiction? Addiction is a chronic relapsing brain disease where the person keep looking for drugs despite the negative consequences of drug. Even though he knows too well what the drug does, he doesn't care because all he thinks is my next dose, my next dose. And this is already an addictive stage. You are already dependent on the drug. And we will see why I continue to say that addiction is a chronic relapsing brain disease. Chronic. So the nature of addiction is chronic, just like when you suffer from diabetes. Diabetes is a chronic disease. So is hypertension. So is asthma. When someone is asthmatic, he or she may experience asthma attack, and sometimes it subsides, but it always comes back. So it's chronic, it's relapsing. Addiction is like that. When a person goes for treatment, he recovers. It doesn't mean that he will not relapse. Because of the chronic nature of addiction and the chronic relapsing nature, the chances of relapse is there. However, there are ways and means of helping and supporting the person with an addiction. We treat him and we support him or her so that relapse doesn't come. There is always a way. So treatment brings a lot of hope for recovery and for long-term recovery. So substance use. Let us look at what we call here the reward circuit. If you look at the slide, the brain there, the reward circuit, the limbic system is called the reward circuit. That is that part of the brain that rewards an activity that is pleasurable. So whatever drugs we take, it interacts with the limbic system where the reward circuit is. You see, our brain rewards all pleasurable feeling we get from natural and normal activities like eating, sleeping, watching a nice movie. Take, for example, I like chicken curry. It gives me satisfaction when I have a meal of chicken curry. My brain tells me that I need to repeat that um, going for chicken curry because it is satisfactory, because it is delicious. I find pleasure in having chicken curry. So my brain will tell me, oh, I like to have chicken curry once a week, or maybe even twice a week, because it is pleasurable. In the same way, when somebody takes drug, the effect of the drug actually is 3 times the pleasure that natural and normal activities give. Therefore, the person will want more and more. So in the same way, when we do something that gives us pleasure, we repeat those activities that give us pleasure. This is how our brain is wired. When substances are taken, the pleasure is much more than when what we get from natural activities. Like I said, 3 times more the pleasure. So such pleasurable effect motivates people to take more of the substances. So until a time, the person may feel that, oh, taking 1 pill of aramine 5 doesn't seem enough to give me the same effect. I need to take 2. And the next time, hey, even 2 is not enough. I need to take 3 tablets. So you develop a tolerance at some stage, meaning that your body need more of the same substance in order to get the same kind of pleasure. And when we develop tolerance, there is a need for more of the drugs, and that leads us to addiction because we tend to want more and more in order for us to feel the same pleasurable feeling. So this is how our brain look like. If you look at the slide on the right, is a brain scan of a non-drug user. If you see there, actually the red dots, do you see the red spots there? The red spots are bigger in the brain, whereas the brain of the drug user or drug abuser, you will find that the red spots in the brain is very, very little, very much less. The reason is because on the right, the image of the brain scan on the right, the non-drug user's brain, the red spots indicate a lot of brain activity because it is healthy. On the sorry, I'm confusing you with my left and my right. On the left, yeah, is the non-drug user, the healthy brain, and on the right is the drug abuser's brain scheme. There is much less activity of the brain, and that's why you see less or very little of the red spot. We will let me just explain to you in a little bit detail on the next slide. So I'm going to play this so that you.
Death has us talking about her fight with addiction for so many years. We don't know if it played a role in her death, but we do know that for more than 23 million Americans fighting addiction, quitting, it's just not a matter of willpower. New research actually reveals that substance abuse causes lasting changes in brain function. Going in depth this morning with our host of Subject to MD, Sanjay Gupta, our resident doctor, the list goes on. You do everything basically. All right, let's talk about your piece. And I guess, why did you choose, and this is your expertise, the function of the brain?
What exactly the brain looks like in someone who has addiction, who's going through this, is a pretty remarkable thing. I think it gives us a lot of insight into how it should best be treated and also understand it. That's what I'm trying to do here. I want to explain a couple of things quickly. First of all, this idea that someone has some sort of anticipation of taking a substance, that's sort of the first step. But then there are two important steps after that in the brain. Stick with me here. So imagine, for example, as you take a look at this animation I'm about to show you, that someone takes a drug of some sort. What happens there, and this is the middle of the brain, is that there is a sense of euphoria. That's dopamine there, the small little particles. That makes you feel good.
That's any kind of drug? I mean, we're talking everything from cocaine to Xanax.
Yeah,
anything.
Just about any kind of drug. And not even drugs necessarily. It can be other things too, certain food substances. Sugar, for example, there can be a certain addiction for it. But I think what's important is the next step. So you have that euphoria, but in someone who's a true addict, take a look at this picture here. On the left side of the brain is, you see the bright areas? That's still feeling good. That's the euphoria. But on the right side is someone who has an addiction now, not as much of that bright spot, and that is relevant. Why? Because they need more and more of the substance to try and get that euphoria back. Think about that for a second. You take the substance, you feel good, but in an addict, that good feeling doesn't last. So what do? You take more than ever before. And that's sort of the basic, sort of simplistic, but basic form of addiction.
Are those changes permanent?
Well, they last a long time. And exactly how long is a little bit of a subject of controversy. But people say you can eventually get to the point where your brain does feel natural pleasure again, but that can take some time. What doesn't go away is this idea of the memory of the addiction. Let's say you're a cigarette smoker, quit for 10 years, pick up another cigarette and start smoking again, and right away you can go back into addiction. Whereas if you've never smoked before, it would take you some time to build up that addiction.
It's like what they say, folks that we know that have gone through treatment say once an addict, always an addict, and there's truth to that, right? You aren't just cured, it's a constant battle to stay away from the temptation or feel that euphoria, right?
That's right. People say that, but I want to show the pictures of the brain to really explain why that is. Okay. You see that dark areas of the brain, you need a lot of the substance to get that euphoria back. So that's why relapse occurs so quickly. They say 3 days of acute withdrawal, which is painful, 3 months where you're the most sort of subject to relapse again, and 3 years before you really start having natural sort of pleasure again from substances.
All right. So you heard what was said, that once you are taking drugs, you are on drug, your brain gets affected and you can have brain damage. That was what was said. And the other thing that was emphasized here is that when someone has recovered, there are always triggers that would make the person come back to using the substance or the drug again.
Whitney Houston's death.
So let us look at treatment for addiction, where we are talking about drug and alcohol, because in Malaysia, actually, alcohol addiction is bad, or maybe worse in some communities. So let us have a look at what treatment means. So when a person has an addiction problem, that is not the end of the world. I want to say this because I see in communities, in our country, we all know and we are aware that there are so many people struggling with drug use and some drug abuse, meaning addiction. And it seems that, especially in the rural communities, those communities that live out of the cities, it seems that nobody cares. People just don't do anything about it, even the family members. They just leave the person on his own, her own. But that is not really true. Maybe that is what we perceive, but that is not true. Everybody cares. We all know that. The biggest problem is people do not know how to deal with it. People are afraid and people are doubtful. So this is where we need to have the knowledge and to inform ourselves so that we'll be able to help people who are struggling with drug use and drug abuse. Help them to get into treatment and help them, support them in their recovery so that their recovery can be sustained, so that they can come back to society and be a fully functioning individual. So, what does treatment for addiction means? The first step, of course, is to acknowledge that you have a problem with addiction. So if we have a loved one having an addictive problem, we need to talk to him or to her and help him or her to acknowledge that there is a problem, that the addiction is causing problem not just for that individual but for others in the family and even the society, the community that he lives in. The second step, after the person acknowledge that, oh, there's a problem, I really need to resolve this to help myself. The second step would be to find a treatment program that can help to restore the overall health, the well-being and the happiness of that person, whether it's yourself or your loved ones or your friends. Now, to find a treatment program that works, when I say that works, mean it helps the person to go into treatment, it helps the person to recover, it helps the person to sustain his abstinence or his sobriety for many, many years, so that he is able to reintegrate, so that he is able to go back to normal life, to earn a living and to be able to contribute to his family and to his society. So this finding a good treatment program is also, I believe, one of the challenges of families and individuals living in our country. So when we want to look for a treatment program, we need to look at what type of treatment is available and what type of treatment is needed for my loved one or for myself. We need to understand that each individual is unique, and therefore each individual has different needs from the other person. Therefore, no treatment program, no one type of treatment program is suitable for everybody. A good treatment facility would be able to assess the individual, the severity of that individual's addiction and other related problem, and thereby plan a treatment that is suitable to the need of that particular individual. So one cannot just simply go and go into a treatment program that is meant for 20 other people, because 20 other people may not be the same as that one person. So remember that just like when you go to see a doctor, each patient has different needs. The doctor also prescribes different type of medication, different kind of advice to different patients. So there are different type of treatment program. The first is called inpatient or residential treatment. In this type of treatment program, the person lives or reside in the drug-free facility and receive either medical, mental care, as well as therapeutic support. When I say therapeutic support here, I'm referring to the counseling services as well as other support services. Some treatment program may provide more than counseling. They may provide other activities like exercises, yeah, like yoga exercises where they do, and meditation and things like that. But there is, you cannot have what do you call this, a standalone kind of treatment that would be effective. No standalone treatment is effective. An effective treatment would consist of the biopsychosocial aspect of the person, meaning that it's not just his addiction that we need to treat. Perhaps that person may also have a mental health issue that has to be treated. And perhaps this same person may also have a medical issue. Who knows? He may be living with HIV. Who knows? He may also be having liver disease or diabetes or something like that. So we need to address and to treat all the co-occurring disease, not just his addiction, but his mental health, his medical health, as well as the other extended problems, which we will look at later. And inpatient treatment are the best options for those struggling with chronic addiction, as well as co-occurring mental health issues. We need to know here that half or more than half of people with addiction also have mental health issues. And the mental health issue or the mental health disease co-occur maybe firstly, maybe because of the substance use. That's when we call induced psychiatric problem, a substance-induced psychiatric disorder, or substance induced mental health disorder. As a result of his addiction, his mental health is also affected. Or it could be the other way. This person may already have had a mental health problem which led to his addiction. So it can be either, we would never know until we actually explore when we do counseling, when we interview the person, when he or she is going through treatment with us. So that is the first type, the inpatient treatment or the residential treatment program. And then we have the other type, which is called the outpatient treatment. This is another form of comprehensive addiction care. In the outpatient rehab or rehabilitation facility or treatment center, the clients do not live there. They come there for their appointment, for treatment, and also to support his recovery. It could be every day, 5 days in a month, 5 days a week, every week in a month for 2 months, 3 months, depending on the need of the individual client. And in the outpatient treatment, the clients can continue to work and care for the family while attending his sessions throughout the week. When we say throughout the week, it is usually during the weekdays, yeah, Monday to Friday. And in this outpatient treatment program, clients may be at risk of encountering triggers that may challenge his sobriety, because he goes back to his home and he goes back to work. So there is always a possibility that there may be triggers that would attract him to go back to using. But here, at the outpatient treatment, we also teach that person to avoid those triggers, to recognize those triggers and avoid them. So we teach them skills as well as part of their treatment, so that they'll be able to stand up for themselves, be assertive enough, and say no to um, any invitation or triggers. And this type of treatment program are best suited for individuals with mild form of addiction, and also a person who is really committed and disciplined to help himself to recover. So when we talk about treatment, the other word that would come to mind is detox or detoxification. Um, Sometimes when you talk to families or to people whose loved ones are affected by drugs or alcohol, they would ask, um, can my son go for a detox and be discharged? We need to know here that detoxification is not treatment. It is only the first step in treatment. So detox help people to safely withdraw from the drugs of their choice, the drugs that they are using, or alcohol, until there is no longer the presence of drug or alcohol in their system. It can take a few days to a week or 2 weeks, or some people 1 month. How long does it take to detox really depend on the individual, what type of drug has he been using, how long has he been using, and how regular has he been using that drug. Yeah. So one person may be able to completely detox in 1 week. The other person may take 1 month. So again, there is no one type of program or treatment that fits everybody, because everybody is different. And so detox, like I said just now, is the first step in treating individual recovering from moderate to severe addiction. Yeah. And when we talk about treatment here, there's a lot to it than this. Before we can provide any treatment, we first need to assess the person, to assess the severity of the person, whether that person has a mild or moderate or a severe addiction problem, whether that person also has a co-occurring mental health disease, maybe depression, or maybe uh, post-traumatic stress disorder, or bipolar disorder, for example. Yeah, I'm just naming a few. And whether this person has a co-occurring medical disease. Maybe this person is really having, or because of his lifestyle when he was using drug, he has now uh, have HIV/AIDS. So we need to have all this treated as well as part of the treatment. And So we need to make an assessment. After the assessment, then we plan for the treatment. That is what we call treatment planning. Yeah, then we begin the treatment. So if the person needs to be detoxed and his detox need medication, then of course um, it will be a medication assisted therapy. Yeah, meaning that medication plus counseling and psychoeducation. So it is never a stand-alone kind of treatment, right? You cannot use, say, hypnotherapy by itself. It would never work. And you cannot just use spiritual, what do you call this? Spiritual aspect, like some treatment centers are faith-based, meaning they only use spiritual values and spiritual and cultural values to help the people to recover. So therapeutic support in the form of counseling, of course, different kind of counseling approaches are being used, and later we'll talk about which type of counseling theoretical approaches are best or are more effective for addiction. Of course, there are so many, but there are only a certain type of counseling or therapeutic approaches that are effective or that are evidence-based. And of course, we need to help the family because the person has a family and the family is affected. In fact, addiction is not just an individual disease, it is a family disease where the family members are all affected and they all need help as well. Then psychoeducation is to help them with their recovery and prepare them for reintegration into society. Of course, part of psychoeducation would also be skills building, avoiding triggers, recognizing those triggers, assertiveness, building self-esteem, self-confidence, and stuff like that. And so some of the therapies that I have shared with you or that I'm sharing with you now, these are evidence-based therapies that have been researched and proven to be effective. Most times we use a combination of all of these. We do not use just one type for all our counseling sessions. So one of the most effective theoretical approach to counseling addiction is cognitive behavioral therapy, or CBT, where this approach actually target to replace these negative thought patterns with productive thinking or positive thinking, which then leads to positive behavior change. I'm not going to talk in detail about all these approaches, but I'm just giving you some information on these are the ones that have been found to be effective, and we call them evidence-based practice. And motivational enhancement therapy, this approach is designed to involve internal motivated change, meaning that we need to help the person to find that motivation from inside of him or her to make the change. Because external motivation is not enough. They need to see it. But internal motivation is something they cannot see, but something they can feel, and something that they feel they need it, they want it. Then the 12-step facilitation therapy, and this is very popular for ongoing recovery and sustained recovery. This promotes long-term abstinence, this 12-step facilitation therapy, by encouraging and facilitating active engagement of clients in a 12-step recovery group. Now, these 12-step recovery group, there are many, yeah, but the most well-known, of course, is Narcotics Anonymous and Alcohol Anonymous. They all practice this 12-step. Um, one of the things, one of the principle in the 12-step program is to recognize that they are hopeless and powerless, and that they need a higher power to help them find the resolution to their addiction. Yeah, and of course, we have also the motivational interviewing. Motivational interviewing is a skill that is used in therapy or in counseling in order to help the client make that change talk, or to evoke a change talk in that client. Yeah. And I want to share with you where to find treatment in Malaysia. Many of you already know, but maybe some might not know. Of course, our agency, Anti Dadah Kebangsaan, or AADK, they have their treatment centers, inpatient, outpatient, in every district, in every state. So I don't know where exactly they are throughout the country. That's why I just say here, information is available at all the AADK district headquarters throughout the country. And normally the program here is either inpatient, that is residential, or outpatient, meaning that you come every day for counseling and for some activities for a certain period of time, maybe for 6 months. And if you need to be on medication, like if you are on methadone maintenance, they will also be able to help you with that. And the residential facility is quite long. If I'm not wrong, it's a 2-year program where the person need to stay in that facility to not just to detox, but to be treated. And also they learn certain skills. They learn to be disciplined, and they learn about how to overcome challenges, how to overcome the triggers, and how to live in a society, how to manage themselves, how to manage their finances. They learn quite a lot of things in the residential treatment centers that is run by our agency, Anti Dadah Kebangsaan. And of course, we have the private treatment centers, Solace Asia, which is in the Klang Valley, KL. This is, of course, a very high end, and I do not know how much it costs, but I know it is expensive. And then you have the Wave in KL. The Wave in KL is not just for addiction, but it's for also any other issues with behavior, especially with youth and teenagers. And And then we have one more, which is an NGO. This is an NGO, yeah, Committed Malaysia. Is located in Kuantan, in Pahang. Sorry. They take in residential, mainly residential. And I do not know actually how many months you need to stay there, but they have a website, Committed Malaysia. The Wave also has a website, Solace Asia has a website. And of course, finally, we have another NGO, Pengasih, which is a very well-established one. Currently, it is in KL, but it will move to Pahang also by the end of the year. This is a residential treatment center, but I heard that they only take boys, only the males are there, no female. Yeah. Whereas Committed, they have female and they also have what do you call the children, the young children, not the teens. So yeah, Pengasih also have a website, so you can actually get their contact through their website. So these are the available facilities. You may be asking why only those. Yes, there are more than this actually, but the others may be mainly faith-based, meaning they are religious-based. There are some Islamic-based treatment centers. There are some Christian-based treatment centers. And I do not put them here because personally I believe that to be effective, treatment needs to address the biopsychosocial aspect of the human, of the individual, not just the spiritual aspect. And then when we talk about treatment, we also need to talk about recovery. Because with treatment, the person recovers. So what is recovery? Of course, recovery is a process. It's a process of change, yeah, through which the individual improve their health and their wellness, where they are able to live a self-directed life and to strive to reach their full potential. It is a lifelong process. Like I said earlier just now, in the beginning of the session, addiction is a chronic relapsing brain disease. So even if the person has recovered for 30 years, you remember what the doctor said in the video. A person who has been addicted to drugs, he sees a trigger. Like, let's say I was an alcoholic. And then I walk around in a mall and I see a bar. And in the bar, I see bottles of wine and whiskey. That would be my trigger. I could very well say, oh, it's been a long time. Let me go in and try. So you see, recovery is a lifelong process. It doesn't mean you have recovered for 10 years, you'll be fine. No, there is always a possibility that a trigger could lead you to a relapse. It could be a lapse or it could be a relapse. A lapse is just a one-time going back and no more. But a relapse is you start all over again. So since we already know that the chances of relapse is there and that a recovering person can be triggered to go back to using the same substance or using alcohol, how do we help a person who is recovering from addiction? If it is our loved one, our family member, or our very dear friend, we need to educate ourselves on addiction and recovery. the nature of addiction is a disease, and the process of recovery is very complex. It is not as simple as, oh, I am recovered already, I'm fine. It's not. With recovery, we need to know about potential triggers, the health issues of that person, the recovery process itself, and the psychological changes that addiction had caused. Yeah. So also, when we talk about recovery, we need to talk about the individual who is recovering, how well this person will recover and how long he can sustain his recovery will depend a lot on the support from the environment, from the community. We are not just talking about people supporting him, but we are also talking about the facilities that would help to support his recovery. Yeah. For example, a person is recovering, he has come out of treatment, he goes back to his family. The family members are not talking to him. The people in the in the taman or the kampong are not talking. They shy away and isolate him. How do you think that person is going to sustain his recovery? He might be feeling rejected and isolated, and the only consolation that he has would be to go back to his old ways where his friends are. So that is why the recovery process is very complex, and the recovery support has to be there. The recovery support is from him himself, the person himself, like how is this person having a strong willpower? Is he always positive? What was he doing before he went into addiction? Has he got a job? What does he has? What skills does he has that would allow him to be employed? Or was he doing a business before this? How successful was his business? Would he be able to go back to manage and run his business once again? So these are his own personal recovery capital. Then the other recovery capital would be from his family. Does he has a supportive family? A family that cares, a family that can help to remove all the triggers, that would listen to him, to his view, and a family that would provide that kind of support. And then the environment and the friends. Does he has friends who are not using that would support him? What about the facilities around him? Yeah, like he might have no transport. Is there any way he can move from one place to the other? For example, if he needs to go back for his follow-up session, how would he go? Would someone take him? Does he has a form of transport? And things like that. And of course, the psychological changes that addiction had caused. He has to deal with these psychological changes. The fear, the anxiety, and of course the shame, the stigma, all these things are things that he had to deal with, and he needs all the support. So we as people need to educate ourselves so that we understand that the process of recovery is not so simple, and that the person in recovery needs a lot of our support in understanding, in giving him that morale. And of course, to understand and prepare for extended problems. Extended problems here would refer to financial issues, rebuilding his or her career or her business, health issues that might have been caused by addiction. For example, the person could be having HIV/AIDS or TB or hepatitis or liver disease, and also to rebuild relationship, to rebuild trust. Because during addiction, his behavior and the things he did might have hurt a lot of people that he loved or that loved him. So he now needs to rebuild that trust and that relationship. And this is also not a very easy task. He needs a lot of help. So we need to understand this in order for us to be able to provide that support. And also, our job in order to help the person in recovery is to make changes to support his abstinence or his sobriety, especially in the first month after coming back from rehab. Sorry. What? How we can support? Like, if it is our loved one, if he's my son, for example, I would remove all addictive substances from the house. If he was an alcoholic, I would never want to have any tin of beer or a bottle of wine in the house. Avoid also social gathering where substances are present, because these are all triggers. And help him to find new sober activities. Well, it can be his involvement in a new kind of activity, maybe gardening, planting flowers, whatever that person is interested in. Of course, you cannot force that person to do something you want him to do. It has to be something he wants to do and he likes to do. And putting a focus on new aspect of life, building relationship with new sober friends, helping him to find new friends who are sober, who would help him in his recovery. And of course, we as people who care for this, or we are called the caregivers, the family members are caregivers, yeah? We need to find support for ourselves as well, because it would be psychologically, mentally draining to take care of a person who is recovering. And how do we find this support? Support group, for example, parents or family members of other individual who are affected by addiction. So recovery support, we talk about the 12-step facilitation program just now, teaching them what the 12-step is about. This is all about learning to be strong, learning to believe in yourself, and learning to stay sober. NA, Narcotic Anonymous, Alcoholic Anonymous, and of course the family support group, and social and recreational recovery facilities. This is what I mean just now when I talk about the recovery capital in the community or in the environment. Where that person lives, are there any facilities for him to play games like futsal, football, sepak takraw, badminton, things like that? Yeah, if those are his interests. When you go to a support group like this in the slide here, all the members are recovering people, so they tell their own stories, and with their stories they also share with the rest in the group how they resolve some of their issues that have been bothering them. So it is supporting each other to grow in recovery, and also teaching and learning from each other how to maintain sobriety, how to stay strong. Yeah. Of course, some of the continuing care support that treatment facility can help out is also integrated services. Um, if, let's say, the person is looking for employment, we can always refer them to some employment agency or people that we know who are giving training for some vocational skills and things like that. Or we can create all this training within the treatment facility by inviting trainers from another agency to come and give training that would be needed by some of the patients or the clients in the treatment center, so that when they come out of the treatment, they are recovering, they are stable enough, they want to do something, but they already have skills that they require to start a new job or to be self-employed. So nowadays with COVID-19 pandemic, and with SOP changes now and then, we might not be able to have a group counseling face-to-face or a group support group meeting face-to-face. So it is very helpful now with technology. We are able to provide online support service on online platform like what we are doing now. And sometimes even counseling services or follow-up counseling services can be done virtually. I have done this a number of times, and clients do find it helpful because they are at least able to talk to someone who can listen, who can empathize, and also who can make referral for the client to be able to see another provider. For example, he is having severe depression, or he's having some other mental health issues, always very anxious, for example. Even virtual counseling, online counseling, we can still make referral to the specialist or to the psychiatrist or a medical doctor. So it helps. These online services, technology has been very helpful at a time like this. Actually, for the past more than 1 year, most of our support services have been online. So this is all that I am sharing this morning for our organization, our NGO, Opta. You can visit our website, and our phone numbers is there. Even if you are not from Sarawak, many of our clients are also not from Sarawak, because we can still do virtual services, online. So you can either call us or text us on WhatsApp on these two numbers, and then you can make a call. So that is all from me now. If you have anything to comment, to share, please feel free to do so, because life is a learning process. There are many things that I'm still learning, that I want to learn. And most times I also learn from people that I talk to. Yeah.
Right.
Thank you.
Thank you. Thank you so much, Miss Cindy. Thank you so much for your very information sharing. And then we do have some questions from the participant as well. So let me bring it up one by one, okay? So we go to the first part first, because today's sharing, Miss Cindy talked about 3 sections. The first one is drug and drug use. Second is treatment, and then the third is recovery. So we go into the first session first, which is drug and drug use.
Would you want me to stop the sharing the slide?
Yeah, that would be great. We can see the participants. Yeah. All right. So the first question is like for example, just now Miss Cindy got shared about the drug use, drug abuse, right? The difference, like drug use is just occasionally may not experience any problems. And then
Right.
for drug abuse, they have already developed addictions toward the drugs. So the first question is there any like what we say, like because most of the people when they take the drugs, they will say that I'm just taking it occasionally. I just take it when I gather with my friends, something like that. So my question is, will the drugs develop from drug use occasionally to drugs dependency and then lead to a very severe, what we say, the drug addictions problem, something like that?
Mhm. Thank you very much. Yeah, very, very good question. So in response to your question, yes, definitely there is always a chance because of the effect of the drug. Remember the brain, the reward circuit. Our brain is wired in such a way that it wants us to repeat pleasurable activities or pleasurable feelings. Yeah. So
Yeah.
from people always, a lot of people develop like that into addiction from occasional to circumstantial use and then to regular and to addiction.
Yes, great. Thank you for that. So we can see that there is a stage like normally people will say that I just use it occasionally. I can still control it, but then eventually it will develop into something that out of control. So there's a very good point that we have to know about this thing.
Yeah.
It's great we don't touch it, don't give a chance to develop into a what we say to depends on the drugs.
Mm.
Okay, and then the second
Mm.
questions. Addiction is also known as chronic brain disease, right?
Yes.
So if like if we already take the drugs before, but then we
Mm.
are in the recovery process, so
Mm.
will the brain damage can recover or not?
You heard what the doctor said just now in the video. Yes, the brain recovers, but it takes time, and how long it recover depend really very much on how much drug the person has taken over how long. Yeah. So and of course you will find that people who have recovered for 20 years, 20 plus years, sometimes they still cannot really make a wise decision. Why? Because part of the brain has really become damaged. Because our decision making part, that part of the brain that makes decision, has been damaged. So yes, the brain damage can be repaired, but how long it takes is very subjective, depending on how long the person has been using, how much the person has been using, and how often he has been using the drug.
I see. Right. So and then one more thing is like we know that when we're taking the drugs, it will cause mental health problem as well, right? Can Miss Cindy list out or share with us like what is a common mental disorder like induced by the drugs?
Mhm. Um, okay, I need to make a correction here. Substance-induced mental disorder. Yeah, substance-induced mental disorder happens. So, like I said earlier just now, not all mental disorders are caused by addiction. In the same way,
Mm,
not all addiction are caused by mental health disorders. Yeah. So some of the very common, what they call substance-induced mental disorder are anxiety, um, depression. Sometimes also it can be your personality disorder. Some people already have, before they are addicted, they already have mental disorder like ADHD, bipolar disorder. So with their addiction, it becomes much more challenging in when they are recovering because they have to deal with recovering from both.
okay, I see. And then we move into the next sessions when we're coming to the treatment, right? The first thing that Miss Cindy got enhanced is the first step is to acknowledge the struggle you have with the addictions,
Yeah.
right? But then the common things that we see, we will get from the user, they might not in the stage of acknowledgement. They might in the stage of denial. They will say that this thing is not harmful. I'm still okay with this. This is helping me in blah, 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 blah. So like what when we can do, like what we others people can do when the client is in a denial stage and not really acknowledge about the struggle he or she have with the addictions.
Okay, very good question also, because I would say most of the clients who come to us would be in denial, especially most of the time it is the people who are referred by their family members or their friends. They come in, they say, it's not my problem, it's my parents who are the problem. Yeah, so they are in great denial, but that is okay. It will be the counselor who has the skill to explore and to help the client to evoke that change talk. Yeah. So the counselor has to be really very skillful. That is why in addiction counseling, we need specific skills, particularly in motivational interviewing. It's only then we can help the person to see that that he has a problem. Yeah, meaning that we need to really listen to him very carefully, because sometimes, let me just give one example. This person can say, no, I really don't have a problem. Then, but earlier he said that he has left school. Yeah, he has dropped out of school. Then he tells you that his ambition is to get a degree, find himself a good job so that he can get married. So that's where you see as a counselor, you see the discrepancy and you say, oh, right now you have dropped out of school. On the other hand, you say that you want to graduate so you can have a job and get married. How do you see yourself do this when you are now drop out of school? That will make him think about the discrepancy. That is where you evoke the change talk so that he can see logic in what he is saying and his behavior. So it takes a lot of skills from the counselor to be able to help the person break that denial and acknowledge there is a problem.
All right. Then others than the counselor, like for example, families members, because family member is the first persons that get in touch with the client. So how families members can help if the client still refuse, like in the denial? The first thing, like we know, if coming to see us, counselor us, we can help them by trying to find a discrepancy, something like that. But for families members, how family members can help them?
I think that the family members knows exactly his behavior and the result of his behavior. This is where the family member can relate to him the problem that he has created, the problem that he has caused for himself and to the family as a result of his drug use. And yeah, so like I said, that it needs a lot of listening and it needs a lot of empathizing on the part of the family members as well. Quite often we find that we as family members tend to be biased towards our loved ones and we don't really give a chance to listen carefully to what is said, what is not said. So these are certain skills also that family members need to learn. For example, be as a father usually doesn't really listen very, that's my experience, doesn't really listen even before the person's finished talking, he will already jump in to make his own decision and conclusion, for example. So as family members, we need to be there, to be present, and to be listening, to be supportive. Like he says he wants something, then we say, all right, so why do you want it? I mean, tell me. Or just say, tell me more about how you want to use this thing that you say you want to buy. Because he may be telling you he wants to buy certain thing for his homework, but he is actually asking for money to buy drugs. So just ask him to talk. Sometimes don't question. No need to ask how, why, what, but just say, tell me about what you are doing. Something like that. Yeah. So it's a matter of really listening. Sometimes we may not catch what the person is saying if we don't pay full attention. We need to listen not just with our ears, but our eyes and also our heart to understand him as parents, as family members, especially because family members are the closest. And whatever happens to him or her outside, he or she will still have to come back to us. Okay?
Mm, right. So next, I also would like to ask about regarding to the treatment part.
Mhm.
All right. So like for those who are, is there any, because there are question asking lah.
Mm.
Let me check it.
Yeah, there's a lot of question here.
Yes, I missed out the one. Yeah, is there any difference in the treatment progress based on the individual volunteer participations in the treatment?
I don't, let me read this properly first to understand. Is there any difference in treatment progress based on it? Does this person mean the
Like if
person who
the
volunteer, who comes in voluntarily and not being referred? Is it?
yes, is there
No,
any
not
difference
not
treatment?
necessarily, not necessarily. Because even if the person is referred, once he is in and he finds that the treatment works for him, he will follow the treatment.
I see. I think there's also many people quite curious lah. Like if we
Mm,
are using a very hard way to push them go for treatment, go for referring them,
mm,
because since they are in the denial stage, will the treatment be effective? But then I gladly Miss Cindy already answering the questions, right? So
yeah.
we're moving to the next parts from Sean. Any specific medications for AUD patients, mean alcohol addictive,
Mm.
right?
Medication is only for withdrawal. It's only during detox. Yeah. If you are talking about alcohol, um, medication during detox, that is to cope with the withdrawal symptom. In Malaysia, they use naltrexone, I believe, and um, I'm not sure if there is dicephoram in Malaysia. I'm
Okay.
really not sure. I don't know about um, because the medication is controlled, I think, by the Ministry of Health. So I cannot say what, but yeah, naltrexone, diphosphorus are being used. And I do remember at some point, some years ago, naltrexone was used to help with the withdrawal symptom for alcohol detox.
How about drugs? Like for drugs, because we know that some they will give
And
medications.
yeah,
Yeah.
I think
So
what you are talking about is the for them to maintain their abstinence, is it?
mm-mm.
Um, yes, for opioid, I do not know if people are still taking opioid in Malaysia, but at one stage when they were taking opioid like heroin, yes, of course, in order for them to avoid the trigger and also to sustain their recovery, these people were given methadone. And there were methadone clinics in the AADK run treatment centers, also in the psychiatric hospital. Yeah, and they call it methadone maintenance therapy. In some countries, they even use methadone for 10 years because it is prescribed. So the dose, I think, is safe enough. I do not know whether we still are using methadone here in Malaysia right now.
I see. All right. And then also got questions asking which are the agency or ministry involved in licensing for drug alcohol addiction treatment center. I think this is
Mm.
referring to like if we are want to create or build a alcohol drugs addiction treatment center,
Mm.
like which agency or ministry that we
Mm.
should involve for the license.
Oh, actually, this is because when you are setting up or establishing a treatment center, it is a business entity. So you need to register it as a business entity with SSM, right? And then you need to get the approval from the AADK, and of course, um, they have a buku panduan, a guideline on how to set it up. So it is quite easy, just follow it. As long as you get the approval also for safety and health. So the people will have to come and check that your facility is safe for the clients. So from Bomba, from the health ministry, from the local council. If you are in Kuching, of course, depend on which part of Kuching you are. It can be DBKU or the council that is near to where your facility is. And if you are in KL, is the DBKL or wherever you are. In any state, you have your own council. So that also, the approval need to come from the council. Yeah, basically council, the fire department, this because this for safety, yeah, and the health ministry and also AADK. You must follow their guideline. As long as you follow their guideline, they will support you.
Okay. Right. So moving next is Miss Cindy, do you know any like what we
Hmm?
say the recovery rate of drug addict in the center? Like commonly like how well is the
Mm.
person if they get treatment, like how well they will recover from that?
Um, I actually do not know because people don't disclose their
How about at
what they
Opta
call
there?
their data. No, at Opta, because we are not a treatment center, we are only providing counseling services
Counseling
and recovery
services.
support. Yeah. So, and what we do in Opta is we provide the psychosocial support and the treatment. When people need psychiatric and medical treatment, we refer them to doctors either in GH or the clinic kesehatan and also Kota Sentosa Hospital. So we actually work hand in hand with each other. Yeah.
I see.
Mm,
And then following from Sean,
mm.
which treatment plan is best for uh, geriatric group of a patient?
What do you say?
Like which treatment plan is best for geriatric group of patient? I think means referring to the old group of
Yeah. Which
elderly.
okay. Which yeah, this would, I think, I would suppose this would be 50 and above, right? Okay. Which treatment plan?
Is
Again,
best.
treatment plan is very subjective because it is specific to each individual, not even to a group. Okay, we may have five uh, elderly people of 50 plus and above, but each of them have different problem. So I cannot give one treatment plan for all 5 of them. Every treatment plan is individualized. This one person by the name of A may be an alcoholic. He wants to be treated for alcohol, but he also has diabetes, he also has hypertension, and he also has a history of depression and what do you call this? Suicidal ideation. And the other person may be just having alcohol and no other issue. The other person has alcohol, but he also has liver problem, very bad liver problem. So I cannot have one plan for all 3 of them. It has to be individualized. Yeah. And again, it depends. Like maybe A comes from a family who is very supportive and he has everything he needs. He has money, he has children, he has friends, yeah, and depending on only his retirement money every month, which is just enough for him to survive, something like that. So all this, when we talk about treatment plan, always remember a good treatment plan is individualized to cater for the need of that individual. So it's not as easy as, okay, now this treatment plan is for this kind of people. No.
I see.
Mm.
Like Miss Cindy, I just want to add on from that. How about from the what we say, if the person is having financial issues, they can't afford the what we say, the private outpatient center, something like that, they have to go for the government. Do the government also provide what we say the individualized planning, something like what you say? They will for each person they have their own needs of like counseling, what things that they are going to cater, something like that. Do the government
Yeah.
also provide the same things?
Yes. Yes. Um, Sometimes, a client need not go to a government totally. Maybe he doesn't need to go to AADK or he doesn't want to, right? But he knows he has a problem. His family knows he has a problem, and he may be willing or is willing to seek treatment. But the treatment cannot be from one person or one place. So they go to Opta, for example, yeah, and we tell them what we provide, what we cannot provide, but we refer. So what we do, we provide the counseling support service, the referral service, and the recovery support. We refer this person to the Sentosa Hospital for the psychiatric issue, and we also refer him to the General Hospital for also for psychiatric, and he has the chance to see a psychotherapist, who will help him with his anger management, right? And continue treatment with the Sentosa Hospital for his ADDHD. You see what I mean? So he comes to us once every week for counseling and also for recovery support service. We also help him to look for a job.
Great.
Right?
So from that, what I see is the very important message to all the audience right now is we don't have we. This is not necessary that we only go for one resources to get the help. For
Right.
example, because a lot of people thinking that if I go to AADK to seek help, I will be okay already. But they need to also understand that there is a lot of like resources that we need to tackle as well. Like we need to go for not just only one aspect. Yeah, right.
Correct. Yes. So actually, treatment here need to be an integrated kind of treatment services. We need to put the word services there because some people might require some training in skills. Yeah, like maybe he has lost his job, but he has already got a certificate in catering or food handling before. So we can help him find a job. Or somebody may be very interested in planting vegetables, for example. Yeah, we help him to look for a place that provide training for planting vegetable. And there are a lot of things we can do for people. I mean, you don't need to go to AADK to find all this. They may not have everything. It's impossible for one treatment provider to have everything. That's why we need to work alongside other agencies.
Okay. All right. So moving next, what is the best measurement tools to measure the patient progress? This is also like quite curious. Like, is there any tools for us to
Yes,
measure? Oh, okay.
of course.
Good.
Like I said just now, even before we start treatment, we need to make an assessment, yeah, to assess the severity of the addiction, the severity of the mental, and the medical. Yeah, then we make referral to the medical and the referral. We provide the counseling, the psychoeducation, the recovery support. And to every 2 weeks, we need to make an assessment of the progress of the treatment. We want to know how effective is this treatment plan or is this treatment working. So after 2 weeks, we make an assessment using a tool, yeah, and also using our observation of the person's behavior, also by interviewing him. Yeah? So it's not just one tool, interviewing, observation, as well as using a validated instrument like the ASI. We always use ASI, the Addiction Severity Index, as a means to find out whether this person is progressing or not. Yeah, sometimes clients also have legal issues. They might have been jailed before, and they have court case so pending. So while they are undergoing treatment with us, they are also thinking about their court case. We also help them, support them in preparing for their court case. Yeah. Okay.
Right.
Do I answer the question?
Yeah, I think. And then moving next is a quite, I think, quite interesting questions like others than drugs, because we know that coffee, caffeines, right?
Yeah.
Addicted category, is it also count as drug addict for coffee,
You mean caffeine and nicotine?
Caffeine, yeah, I think caffeine. This question is referring to coffee lah. Yeah.
Okay, caffeine, yes. You know, just that caffeine comes under stimulant, right? Is it stimulant?
Yeah. Mm-mm.
Okay. It is legal, right? So it's not psychoactive. And you drink coffee every day. But there is also a tendency for people to be drinking and over drinking too much of coffee, that it can cause medical problem like palpitation or heart disease. Yes, it is possible that one can get truly addicted. I mean, 1 cup of coffee a day is completely normal, but there may be people who may be drinking 2 teapots. I'm not talking about teacup, 2 coffee pots of coffee a day. That's already a lot. Yeah, and why? Because if I don't drink coffee, I don't feel alive. Huh? Or if I don't drink coffee after my lunch, it's not complete. I must drink coffee before I sleep, otherwise my day is not complete. So that becomes an addiction. Yes. So legal substances does not mean that it is safe. Legal substances like caffeine and nicotine in cigarette, they are legal, yes, but legal doesn't mean safe. Okay.
Right. Okay. And then moving next is like combining it. Like one participant is asking for the porn or sex addictions will also bring the big impact to our reward system, right? So
Yes.
how is the porn addiction treatment similar with the drug treatment? And then
Okay.
as well as one question is about the gaming. Similar things like for gaming addiction treatment, is it similar to drug treatment process?
Um, I would say yes and no. Yes, because
Mhm.
sex addiction or watching pornography becomes an becomes addictive. Yeah. Why? Because the person who watches it derives pleasure, and the person who has sex with everybody and anybody, multiple sex partners, gets satisfaction and pleasure from doing that. And again, you do it because the brain tells you to repeat that pleasurable reward, that pleasurable feeling or satisfaction. And the treatment process, of course, we don't. It can be the same. In other words, that if it is really severe, that the person spends so much time in the house or somewhere else watching this pornography instead of doing work and doing something else on the computer, he or she is using the computer to watch all this. So that's very, very unproductive. And that he or she may be spending 8 hours a day, 6 hours a day. That's already an addiction. Yes, that person need to be put into a phone-free or sex-free addiction treatment facility, because only then you can take him or her out of that environment. So if so severe, that person has to be rehabilitated in an inpatient or residential treatment center. So the process of treatment, of course, you don't need drugs, medication, but you need a lot of psychotherapy, and you need a lot of recovery services for them to be able to recognize that their behavior and activity is unproductive and is also harmful, right? And to let him see the logic, the reason, and the benefits of being free from this kind of addiction. Yeah, all this
Uh,
gaming and sex addiction or pornography, all these can be treated.
okay. Great info as well from Dr. Dylan. Dr. Dylan got asked quite a number of questions, so we go through one by one. So
Mm,
regarding first thing is like Dr. Dylan got explained about the what we asking earlier, like
mm,
substances induced mental disorder.
mm, mm,
Yeah, so from Dr. Dylan sharing, you can see that actually
mm, mm,
many induced mental disorder are only temporarily lah.
mm, mm,
Mm,
mm.
yeah. And then Dr. Dina also got asking about, recently got inquired about the AADK recommended hourly
Hourly.
commitments for outpatients.
Mhm.
And then they say that the immediate base for recovery require 30 hours per week for the treatment. So how can the people avoid like disfranchisement from the positive social influence or staying in employment if they have to commit 30 hours per week?
Very, very good question. Yes, if the person is being employed, I believe that he or she needs to be talking about the problem to the employer, because the employer needs to uh, give leave for him or her to be in treatment. And I believe that many employers um, do provide this kind of leave for their employees to enter into treatment. And I think he's talking about outpatient, right? What he say here? Yeah,
Mm-mm.
yeah, and how people
Outpatients.
can avoid, yes. That is what I mean. The person really has to talk to the employer about his problem and the need for him to enter treatment, and then to commit to that treatment 40 hours. Yeah, this is true. Of course, we do need this. That's why I say, like, for community-based, for outpatient, the person need to come and see us every day, at least 5 days a week. Because besides the counseling itself, it also involves some activities, sometimes group activities, and also some form of training. So one day, maybe a few hours. And yeah, how can this person leave his work? So it really has to be upon the discretion and the kindness of the employee to understand that he has to be in treatment. Some people may be giving unpaid leave or half-paid leave or something like that. I don't know. I mean, I really don't know how to answer this on the part of the employer. I'm not sure also if there's a policy from the government to allow people to go for this kind of treatment, continuous treatment for maybe 1 month to 3 months, like this. Yeah.
I think this also raise up to another issue, which is the social stigma. And Dr. Dylan do also talk about this one, like social stigma related to drug use, like how stigmatized in hiring a person with, like, just question marks, how stigmatized in hiring a person with substance abuse issues, and then how the community can be supported to reduce the stigma as a part of the model of supports.
Yes. When we talk about treatment and recovery just now, is something I forgot to mention, that addiction brings a lot of stigma, not just to the person, to the individual, but to the families as well as to the community. And this is the reason why relapse cases happen often, because of the stigma, because of the fear, the anxiety, and people are isolating people in recovery and ignoring them, and also not acknowledging their past achievement and their capabilities and skills. So what we are trying to do now, for your information, in Sarawak, the Ministry of Welfare, actually the what do you call this, Social Development Council, has set up, has required that the district officers, all the district officers, set up a one-stop committee on drugs and substances that work along with other agencies, district office, the police, the health, the hospital, I mean, and the clinic kesehatan, the social workers, the counselors in school, and the teachers, parent teachers association, the village head, meaning community leaders, yeah, as well as the AADK. So these people work alongside each other to address this drug problem. They have outreach program to help the community, which is the parents, the individual who are affected, and the community at large, on helping to support people to go into treatment, helping to support those in recovery to reduce stigma. Currently, also, OPTA is working on a cultural recovery support model in order to reduce stigma and also to help people recognize the strength, the capabilities, and the skills of people in recovery and how much these people actually can contribute to society economically, socially, when they are recovered with the support of the community. Because the problem comes from the community. It is the community who have the resources to know how to help these people to come back and reintegrate and be fully functional. I don't know if I answer that question.
Yeah. I think other than the community, like what we're doing today is like a webinar series for the public, let them know more about the drugs things, giving them the knowledge is also one of the efforts that we're trying to reduce the stigma. Because with the correct knowledge, we know about this thing, we know about how we can support them, how we can give the treatment. We reduce the stigma about like looking them with difference. Following next, I think these questions I need Miss Cindy to answer because I'm not too sure about this thing. If you are doing CBT during the treatment, does it not follow the relapse prevention model? Because the relapse prevention models include community-based CBT groups in the recovery phase.
Yes, in fact, when we are using CBT during treatment, we are also at the same time targeting or teaching them how to prevent relapse. We also use CBT in a way in our recovery support group. Yeah. So relapse prevention or recognizing triggers, building skills like self-confidence and self-esteem. All these are part of the continuing care of treatment, which is, of course, in our recovery support.
Okay. I'm still a bit blur about this part, quite deep. Okay.
Yeah. I mean,
it's regarding to the treatment in detail treatment, right?
Yes.
Okay. And then the following next is like, what is the perspective taken by a drug rehabilitation counselor in terms of illegality? Is there any requirement to report the drug use? Or does the restriction of fears of restriction reduce the likelihood of people?
Well, this is a question that it's I cannot really answer this because it is in terms of illegality. What is the perspective taken by drug rehab counselors in terms of illegality? First and foremost, we as counselors, we have our ethics, right? And one of our ethics, of course, is confidentiality. However, if this person's drug use is what do you call is a danger to others, not only to himself, we have to illegality in terms of illegality, because once you use drug according to the drug act, I do not remember which act this is. Once you use drug, you are already in possession of drug. It is actually illegal, so one can report. However, for us as counselors, yeah, when people come to us, our duty is first and foremost to save them, to help them. About reporting, we don't. But if they go to what do you call? And anyway, you cannot. When they come to us for counseling, we cannot find drug in them. So how do you report? Yeah, it's only they are telling us they are using, and we won't have to ask how much you are using, how many grams of this that you are using. Our duty is to help them to address this problem and to keep them safe from harm. If they, for example, are depressed or they are suicidal, we need to address that immediately. So we cannot be thinking of making a report first. And is there a requirement to report drug use? As far as I know, we have not been told or instructed to report that our clients are using drugs, because the clients who come to us are our clients. They are with us, and we keep whatever record we have with them in confidence. It's just between us, themselves, their families. That's all.
Thank you so much for missing the explanation. I think this is very important as well for the clients. Like if like we really, if we don't, as a counselor during the therapeutic process, we don't really keep the confidentiality, how the client will really trust and us and then really committed into the treatment. Yeah. So I think that there's a great explanations for that. Okay. So I think I don't see any questions more. But I do see that Dr. Dylan's agree with what Miss Cindy shared about the, just now the one-stop center exists in the Sarawak.
Yeah, yeah.
Right,
One now they are going to have community development and intervention center in each district. However, that is going to take time, because when it comes to government building, they will, like what happened in Bao now, we are supposed to have this community development and intervention center operational by the beginning of the year, but it has been delayed, not only because of COVID, but the process of handling the building, a government building, to us as NGO takes time. So that's why. And anyway, I would say that actually in Sarawak, in Malaysia as a whole, we really lack private treatment center that offers affordable fees. We have the Solace, which is really exorbitant, I would say, and which I would be looking for something like anybody or the average income earner can afford, but the services need to be of standard quality. The treatment services, the recovery services, the integrated services. So I would always be looking for an evidence-based practice approaches in the treatment. That's what I want to see. And that's where I would want my clients to be.
All right. Okay, so I think that's it for today's sessions. Thank you. Thanks again for Miss Cindy's for your very information and very clarifications, explanations, and clarify all the questions from the audience, from us. Yeah, we do learn a lot of things. So before we end today's sessions, we will have this thing, what we say, the e-certificate form. So feel free to scan the codes, and then after that, you fill the feedback form. Within the 14 days of working days, we will send out the e-certificates for the participants. Yeah, so have you scanned? Take 5 to scan this. I also will drop a link later on at the group chat there, so you can click on it. And then this is our center, Body Counseling Center. We are NGO counseling. So we provide community service of counseling service for those who need counseling service. So feel free to drop a call or book appointment via Zoom counseling. You can always call us at our hotline, as stated in the slide there. And for most, tomorrow we also will have a Chinese sessions on this topic. And we do invite what we say the anti-drugs representative from Bintulu to talk about this thing. So if you have interest to hear more about this thing, come to join us tomorrow. All right, let me drop the comment there first. Yeah, so I think that this is the link. Okay, I have dropped the link there. So feel free to access it. Yeah, if you can't scan, you can just click the link that I dropped at the group chat there. So access to it, and then you just fill the feedback form. All right. So once again, thank you, Miss Cindy, and thank you all of you who attend with us for these 2 hours.
Yeah, thank you very much, everyone. Thank you.
Thank
Sim.
you. Thank you. Take care. Bye bye.
Take care.
Thank you.